Chronic kidney disease is surprisingly common. About 1 in 10 people have some degree of it, though most would be unaware they have it. Yet a very small portion of these people will experience kidney failure. Your kidneys are biological marvels. They're sometimes referred to as little chemists because they analyse and intervene in many processes in the body and control many vital functions. There are 5 stages of chronic kidney disease. These stages relate to the amount of kidney damage you have and how good your kidneys are at checking and cleaning your blood. A good diet can help prevent infection and help you maintain a healthy weight, which reduces the stresses on your body. By working with your healthcare professional and dietitian, you can work out a plan that's right for you at the moment. It will help you regulate your intake of protein, calories, vitamins and minerals each day. There are 3 treatment options available for someone with end-stage kidney disease: dialysis, transplant, and supportive care. The peritoneum is a membrane made up of 2 layers. One layer lines your abdominal wall, while the other lines and protects your main organs. The space between these membranes is called the peritoneal cavity. Peritoneal dialysis is performed by you, the patient. There are 2 methods to choose from. In one, patients treat themselves manually 4 times a day. Another is performed at night with a machine that automatically drains and refills the abdomen. The dialyzer is a filter that removes waste from your blood. It's a circular tube filled with thousands of hollow fibres. The walls of these fibres have tiny holes in them. The blood travels through the fibres in one direction, while dialysis fluid flows through the gaps between the fibres in the opposite direction. The pressure and concentration of the blood is greater than that of the fluid. This imbalance draws the blood toward the dialysis fluid. However, the tiny holes in the fibres will only permit some elements like water and small waste molecules to leave, while important larger elements like blood cells and most proteins are blocked. Kidney transplant surgery will be performed while you're asleep under general anaesthesia. The donor kidney is removed first using laparoscopic surgery, sometimes called keyhole surgery. The surgeon places the donor kidney off to one side of your lower abdomen. Unless they're causing problems, the old kidneys will be left in place. The artery and vein of the transplanted kidney are sewn to the blood vessels in your pelvis. You are the only person who knows the impact that the treatment is having on you. If you decide that you want to stop treatment, it's very important that you take plenty of time to talk about your decision with those close to you and with members of the kidney team who are looking after you.
O le ala lea e tāua ai le whasosoani a laufo mai, ma se tasi whaapitolo nei loe le tūtau mafa e whausia se ala fua mo oi. Ma e whasosoani lea i le whaawasenga ina, ma le whauru whale ina o waila au ese mo lo tino i aso tai tasi.
Koe ni ihi, koe whai konga o kna ho haaki ai, koe maari hola a ngahi hui. Ka koe lahi e nautol, o kwhai at pe, pena wangi ai. Koe taha, koe te pōpula hange hano hai ki ta kia misin he taimelahi.
At first I thought, oh, I'll never learn this. And I remember very vividly the first day they gave me one of those needles and said, you're going to stick this in your arm today. And I thought, not on your life, Nellie. But, you know, when nobody was looking and the nurses were there, you put your first one in and you think, oh, I did it.
It took about a good couple of weeks before I could actually feel the benefits. And I remember waking up one day and I went to work and I was just working real quick. You just felt like doing stuff because you had the energy, you know? You know, my family they obviously noticed the difference as well. Personality-wise, I'm more bright, bubbly, rather than focused on myself and self-pity and all the rest of it, you know what I mean? And then all my friends as well, they're like, wow, you're really bubbly, what's happened? You know, did someone hit you over the head or something, you know? Like...
When you're living with somebody who's been confined pretty well to a chair and you see somebody walking around just like they used to and without puffing and it's worth it, definitely, yeah.
It's way exceeded what I even dared to hope. People had talked about it as being transformational, and it certainly is. But I didn't actually dare to hope that it could be as good as it is. It is fantastic.